Hello, everyone. Okay, we look like we are working right now, so please do let me know if we are working. I don't know if this is a YouTube thing or what, um, but we had some issues with the live stream. So we are starting over, and hopefully, if you are here, you can hear me and see me and let me know what's up. So please do put in the chat if you are there. It's I'm not getting the feedback that I normally do as far as on my sound. So that's a little concerning, but hopefully if you are here, okay, now I see people joining. If you can confirm in the chat that you can hear and see me, that would be really helpful. I was going to put that in the chat. That way we can get started since live stream number 1 didn't quite work. And unfortunately, I had already gone through a lot of the key points. So we were just going to do that again. I also had a question from, I think it was Susan, and I did copy that. So we will answer Susan's question about HIPAA compliant texting and email and using AI. So lots of things. But in relation to HIPAA, we will absolutely answer that question about how do you know whether or not it's HIPAA compliant, and do I have any recommendations? So one of the things that I had done in the other live stream was shared right off the bat. I want to say, we are going to talk about HIPAA and how can you be HIPAA compliant as a therapist. And we're going to go through not every potential scenario, obviously, but what most practically are you likely to experience? So where can client data actually be vulnerable, and also where can you make a difference and what is worth your time and energy as far as investing. Now, if you do want a HIPAA expert, I highly recommend Person-Centered Tech. So I just put them in the comments, and the link to their website, we'll also put that in the description underneath once we, after this live is posted. So Person-Centered Tech has a wealth of resources. I recommend that every therapist get on their email list because they are like the HIPAA gurus for mental health therapists. And they actually do vendor reviews. So if you are considering any type of platform, you can go on their website, find the vendor reviews, and put in the actual platform that you have a question about and see what they say. All right, so I haven't gotten any feedback yet. We are going to continue on and just assume that everything is working. So what we're going to talk about today are the 3 things that you need to use a system or platform or device securely as a therapist. The first thing is black and white. You absolutely have to have it. The other 2 are really dependent on, and it's very similar to documentation where you're looking at a framework and not necessarily black and white rules that are always yes or no. And then we're going to talk about what are the 4 most common scenarios or 4 common things that that are problems that you might run into, and also how can you manage those. So we'll go through ideas for how to help keep your client's information most secure. All right, and I don't see any comments. If you do have questions or comments, feel free to put those in the chat. It would also be really helpful, if you can hear me, if you would post whether or not you can hear and see me, since we were having issues with the other live stream and we had to do a whole new meeting or a whole new link. Okay, so what are the 3 things you need to be HIPAA compliant? So number 1 is non-negotiable. You absolutely have to have what's called a business associate agreement, or a BAA. And that is essentially a contract between you and the platform, device, service that says that you are keeping client data, or or that platform, device, service can access client data, and they know that. And because of that, they are saying they agree to keep it secure. So thank you so much for confirming you can hear and see me. Awesome. So maybe we can keep this live active and not have to do a whole other link too. Okay, So you need that BAA to confirm that. And any entity that is giving you, that is trying to get your services, that is trying to get you to pay for services, such as an AI progress note generator, they should give you a BAA. And if they don't give you a BAA, you cannot be HIPAA compliant and use it. So that is just a nice black and white rule to have for yourself. If I can't get a BAA, then I cannot be HIPAA compliant and use this service or platform for my clients' data. All right, so that's nice black and white rule there. We'd like those. Now, the next part is that the software or the platform itself has to actually be HIPAA secure, right? So could an entity give you that agreement and not have their stuff be secure? Sure, but it's unlikely, and they are essentially saying, we agree to this and we will be responsible if that doesn't occur, right? So that's number two. The third thing is that you actually have to use it in a HIPAA compliant way. So you could have, for example, your practice management system, your EHR, would need to be HIPAA compliant, would need to be HIPAA secure, would need to give you a BAA because you are absolutely housing client data there and keeping lots of it there. And they should be aware of that as a company specializing in this, right? So they are taking the initiative to stay on top of all of these mandates and rules and laws so that you don't have to. But let's say you then take your computer and you go sit in a coffee shop and you're on their Wi-Fi and you are like have a big screen open and lots of people can see you because where you're sitting, people can walk behind you and they could see your screen and you have all of your client records up. That would be an example of the platform itself is HIPAA secure. It is set up to be secured for HIPAA. They have all the agreements, you have a BAA, but you as the practitioner are not using it in a HIPAA compliant way. So compliance is on you, security is on these other entities, platforms, devices, etc. All right. So that's a really key thing to remember. It's not just about getting something that is HIPAA secure. It's about then also using it in a compliant way. So let's dig into 4 common issues that can come up for therapists actually using these platforms in a HIPAA compliant way. So the first one to think about is your devices and how can people access those. And so when I say devices, I mean anything like a phone, your computer, an iPad, a Remarkable or some other kind of writing tablet, anything where you have client data, anything where you are inputting client data or accessing client data from that actual device, a product. So how can you access it? And is it difficult for other people to access it? So for example, your computer. Is your computer encrypted? Do you have a password on your computer? If you do have a password on your computer, is it one of those that's really easy to figure out? How good are your, and we're going to talk about passwords next. So actually I will stop there, but thinking about devices and access. So how easily can others access your device? Even think about things like with our phones and the notifications that come up, right? So this might not be specifically about people being able to access. Maybe they would need a good password and need to know your password to access your phone. But do you have notifications popping up constantly where they don't even need that because they could just read the summary right there? These are all things that you can change in your settings. Same thing with your iPad. Maybe you think of your or actually, let's use Remarkable, a tablet that a lot of people use for note writing. So is that Remarkable set up with a really good password? Is it as secure as you would have for your iPad? Because typically, Apple products are set up pretty well so that it's not that difficult for the average person to just create a pretty good password and have it be encrypted. And often for other products as well, if it's a computer or a phone. But if it's something like a Remarkable, it's not made to be secure. It's made to be easy to use and access. So I'm not even sure, honestly, if you can set up a password for it or not. Regardless of that, how easy would it be for someone to access that, if they got a hold of it, to actually then read client notes, like maybe you can have the notes locked in some way. But these are all things that you want to think about when you're thinking about devices and how easy is it to access information. How easy is it for me to log into the device? And then how easy is it for me to access information if I do get a chance to log in? Also think about where are you keeping these things? So if you have a laptop, and I know a lot of people, this used to be a big thing when I worked in an agency and I was QA and we had a lot of field-based staff and they're traveling with their laptops all the time. And so people had things stolen, right? So if you use an iPad or some other kind of tablet, and you let it sit in the back seat of the car, then, that might get stolen. So thinking through how can people access those things? And so for devices specifically, we're going to talk about passwords next, but making sure that you have any kind of tracking on there. So for iPhones and computers, it's very easy to set up, like Find My iPhone. And that way, if you do lose it and you don't know where it is, you don't know if someone stole it or what, it's easy for you to track down and find. And then also setting up a system where you can lock or control access, or you can wipe the device if it is lost or stolen, so that other people can't then figure out how to hack into it. So doing that, if you have a laptop, if you use your phone a lot and access any client data from your phone or an iPad or something like that, having those basic things set up, that's a really common issue that comes up for therapists is simply losing a device, being unable to find it or having it stolen. And so you want to be able to wipe it or control access to it if that happens. All right, the next thing we're going to talk about is password management. So password management. How easy would it be for someone to guess your password, right? So do you have complicated passwords set up? Most of us, I think at this point, and like this day and age, we're used to doing the complicated passwords. And then that also lends itself to, I have so many complicated passwords that all require different things that I need a place to write down all my passwords, right? So do you have that set up securely so that it's not just in a notepad, right, on your desk where anybody, if they broke into your office or your house, could find it? Is it easy or difficult for people to guess your passwords? Are you changing your passwords if you need to do that? So while it can be really annoying to change your passwords on a quarterly basis or whatever might be required by your electronic health record, it really does help with keeping things secure. So that's a reason that a lot of software platforms will do that. But thinking through, and one thing you can do is use a password management system where you just have to know one, and then it kind of logs into everything for you and it changes the passwords up so that it's very difficult if some hacker did get into, your Amazon account for some reason. They only get access to that. They then don't easily have access to your email and all the other things that they might find. So that's what you're trying to do by switching up your passwords, changing them frequently, and by, having them managed by something like that. There have been instances where those platforms also were hacked. Nothing is perfect, and that is not the goal with any of this. None of this will be perfect. There's no such thing as no risk, and HIPAA does not say that you can't have any risk. It's all about what is your realistic level of risk. So you as a private practitioner, let's say you have 15 clients a week, they're private pay, they're not working with insurance. You have a very different level of risk than a hospital that's working with thousands, potentially millions of patients and has very in-depth records on all of those people. So you are set a different standard. And, so the HIPAA police, like if they exist, they are viewing you differently as a private practitioner. But it is still important for us to think about, because on the practical side, if we manage our devices and our passwords in maybe a somewhat inconvenient way, but fairly simple way, then we can mitigate that risk across the board. no matter if we're working in a private practice or for an agency or something else. All right, so that's passwords. Number 3 is public Wi-Fi. So do you use public Wi-Fi? And if you do, what are you using it for? So when I say public Wi-Fi, what do I mean? I mean, if you are going to Starbucks and you are logging into their Wi-Fi because you don't have Wi-Fi yourself, or you don't have great cell service or something, or you're going to another coffee shop, or you're working at a hotel. Let's say you're traveling and you bring your laptop so you can get some work done. If you log into the hotel Wi-Fi, then even though there's sometimes like a password system set up there, it's still a public Wi-Fi system. And so potentially anytime you're using public Wi-Fi, other people could be on that network and could try and hack into your system. And so you are potentially opening things up to be found through that. So it's a really easy thing to avoid doing if you have any kind of decent web service, with your mobile phone. A lot of times you can so I've done this where I just hook up my laptop to my mobile phone and use that as a hotspot. And that way the information isn't going onto a free server somewhere. I will say do be careful, because one thing my phone does is that if my Wi-Fi goes out, or if all of a sudden I don't have Wi-Fi somewhere, it's both kind of convenient and also annoying, is that it will actually hook up to other Wi-Fi. And so my cell service provides Wi-Fi from different, different antennas that are local. And so it's kind of nice that thankfully I'm not dealing with client data personally, so I don't have to worry about that. But if I was accessing client data from my phone, I would need to turn that off. And that is something you can turn off on your phone. You can have a setting where it just doesn't automatically connect to Wi-Fi. You can also change that on your laptop. And sometimes your laptops will do that. So let's say you start using a laptop for work and you got a new laptop from home, or you got a computer at home now, and so you're using your laptop for work. It will often remember old Wi-Fi networks that it was on. And so then it would automatically log in when you do go to that coffee shop, even if you're planning to use your hotspot. So it's just something you want to be mindful of and turn those features off if it's a device where you access client data ever, because that can be a really, really big deal. And the thing is, especially if you are accessing your electronic health record or your practice management system from that device, that's the type of thing you never want on public Wi-Fi. You never want to access those things on public Wi-Fi and open that up. And David asked, could a personal Wi-Fi tower work? T-Mobile makes one. I would assume so. I am not like I said, I am not a HIPAA expert, and I'm definitely not a tech expert. So I would assume so. The thing is, it's really just, is it something that would be publicly available to others? That would be a great question for person-centered tech. But if it works kind of similar to the hotspot, then that's probably fine. And again, this is all within reason, and you need to be able to work, but you also need to keep your clients' data secure the best that you can. And so if you're accessing a text message, that's very different than logging into your practice management system, where maybe you have your clients' insurance policy information and and their date of birth and all of that kind of stuff, right? So while both may technically be wrong to use on a public Wi-Fi system, one is going to be more harmful than another. So that's, there are kind of tiers to considering these things. All right. Let's see. Our last point is cloud storage and other storage. Okay, so let's talk about storing client data. So with HIPAA, data needs to be safely stored, right? And that is any data. So whether that is paper or electronic, it needs to be safely stored. It also needs to be accessible to clients. So sometimes these things you are weighing accessibility and security. But those are, both points within HIPAA. We often forget about the accessibility portion of it. So Cloud storage is typically going to be much more secure than anything you can offer on your own. So for example, I have personally known therapists who have had their offices burned down, like over the weekend, like literally to the ground, it burned, and they had no awareness of it or no warning whatsoever. I have known people whose computers were stolen. I've known people who left their computer somewhere and it was lost. I have known people whose offices have flooded. And so it was just, a pipe burst or whatever above them. And so their office was flooded and they had client records there. So physical files are quite susceptible to these potential breaches or potential destruction. I also know someone whose office was broken into and the file cabinets were opened. And when they came in the next day and saw everything, they saw the file cabinets were opened. They saw some things were kind of moved around. So they know somebody went in there and kind of like rifled through things. They have no idea if they actually stole anything, took anything, copied anything, wrote anything down, right? So all of that's to say, online often is very secure, and cloud storage has advanced dramatically in 20 years. So it's very easy to use. It's very cheap to use. It is absolutely well worth the money to use if you are doing anything electronic. If you are all paper, this doesn't apply to you, and that's totally fine. But if you're any electronic at all, having a cloud storage system is great. What is cloud storage versus other storage? So that means there is a difference between me opening up a Word doc on my computer, typing a progress note, and saving it to my computer, like having a folder file for a client, with maybe a client name, and I save it there. That can be secure. It's not as secure as if I do that on a cloud storage system, because then, again, if something happens to my computer, the physical device, then that record is lost or potentially stolen and accessed by somebody else. Versus if I have it on cloud storage, I can log in to that storage from any location. I can access it from any location. And that way I can also control who is accessing it. And so that's a big difference between, like, a cloud would be logging into Google Drive, or your practice management system is probably using some type of cloud software as well. Things like Dropbox or Apple, literally iCloud, right? So those are all cloud storage systems. And Google does give you a BAA if you would like to use Google Drive to store client data. And Google is actually pretty secure. It's nearly impossible for anyone else to log in to your Google account without you, at the very least, being made aware immediately. And so when I used to do other things and have to actually log in as people or with people to do things, I literally had to be like on the phone with them with their information and talking to them so that I could type in all the confirmations that Google was sending them in a separate location. So Google is actually very, very secure in that way if you're wondering about where to store things. But to me, I would recommend that over just storing on something on your computer, especially if it's going to be important or you're going to have a lot of files, because it's just going to be, it potentially complicates things quite a bit. It's like having a file cabinet. It's just that it's in your computer instead of in the cloud. All right, so those are all of those things. What I would recommend, so we talked about devices and accessing those. We talked about passwords. We talked about using public Wi-Fi, and we talked about using cloud storage versus other storage. So those are, in reality, HIPAA is, however many thousands of pages or something crazy. Those are the things that in everyday practice you are having to manage and consider. So what I would recommend is just pick one and start there and then move on. And instead of getting overwhelmed and trying to do all the things, it is better to just do one thing. And with this, with anything with HIPAA, with technology, with client records, with storage, you're constantly adapting anyways. These are things that 2 years from now you might need to do differently. And that might be based on your needs, based on a new device you get, whatever changes. But use these as principles and as things to consider as something you will always have to update and revise. And I recommend just like once, pick a month a year that you're going to say, this is my HIPAA month. And so in one of the programs I run, it's June, and it's every June, it's just like checking in on all the tech things. And so maybe set a reminder for yourself to do that. And then you just pick one of those areas to focus on. All right, let me go to questions here because we did have some questions. So Susan had asked a question early in the chat, and then I'll go to David. So she had said, please advise on HIPAA compliant texting app and email. I have Hushmail, but it doesn't seem to work with other platforms. Also, has anyone used an AI system for progress notes? So I'll answer this in a few different ways here. I am not the person to advise you on which HIPAA compliant texting app or email or anything to use. That is why I recommend you go to personcenteredtech.com, which is in the chat there, and we will put in the description below after this video, and check out their vendor reviews. So they do vendor reviews. You could do that search. They call it HIPAA appropriateness reviews, and they literally will review very specific platforms and have reviewed a ton of them. So they will give you, what does it say? If you can be compliant with this system, a yes or no. And then they will give you, is it recommended for, where they say recommend for your HIPAA risk management needs. So is it something they recommend, and can you be compliant with it? They will give you yes or no's for that, and then they will give you a description, and that way you can confirm based on how, because some things that are really secure are not really user-friendly. So they do reviews of multiple things so that you have those options. So I would start there, check there, and see what they have to say. The next thing I would say is something like Hushmail. So if you've heard about like HIPAA compliant texting and texts and emails, for example, email, what that often does when you pay for something like Hushmail, which is a HIPAA compliant email system, what it's doing is instead of sending the message across the internet via email, so I create a message, I click send, it literally kind of travels across the internet, right? And then lands in somebody else's inbox. What these like end-to-end encrypted systems do is instead I type up the message, Hushmail saves it right here, and then sends a message to that intended recipient and says, hey, you have a message over here. And so that person gets a message that says, hey, you have a message. And then when they click in that email, they can read the message. And so it's actually not sending the data over the internet. It is instead, keeping it secure, probably in a cloud storage system. So that is the difference between just a regular email that you're sending every day and one of these platforms. So it definitely is keeping things secure. Is it a big deal on a practical basis to send some data over the internet? No, I don't think so. I think a lot of, especially like client content, hackers don't care about somebody fighting with their spouse, right? Hackers do want an insurance policy form or, a bill that might have special information about someone, because they are interested in information where they can steal identities or steal passwords and steal data that relates to money. So that is something that they are looking at, especially as it relates to insurance. So you do want to be careful with those things. You don't want clients just signing a PDF and then sending it to you and having that go across the internet. You want it to be saved somewhere else secure, and it's up here and you're both going there to access it instead of it moving across the internet. All right, so there's that. And then and then AI for progress notes. She said, has anyone used an AI system for progress notes? And I have a whole series on that, so you can check that out. It is going to be updated soon because there's so many changes with that. But with the progress note system, use those same principles, right? So it has to give you a BAA. You have to have a business associate agreement, or else you cannot be compliant with HIPAA and use it. So you cannot use the unpaid free version of almost anything. You cannot use the unpaid free version of ChatGPT. It's not giving you a BAA, you can't use it. And that is a black and white rule. And I do talk about that with the AI videos. And I don't think that you can use any platform, even if you're not giving it, people will say, well, I'm not giving it PHI, I like strip all the data. If you are giving it information about someone's session, that is PHI. So for a platform to give you a progress note, you have had to put in some PHI. It may not be name and date of birth or diagnosis, it's still considered PHI. So do not use one that doesn't give you a BAA, and likely you will need to pay for it. And that's okay, because that company is saying, we agree to have special security standards, right? We're paying attention to different things than other companies might be because we understand this data needs to be secure. And so it's a reality of what we do in our work, and it's okay to pay a system to do that for us. All right. Beyond that, I would say check out the reviews. There's so many AI platforms out there, and a lot of them do give you free trials, and I think they will still give you a BAA with the free trial. Don't use it for real clients if you don't have a BAA. But once you have that, and if you can do a free trial, absolutely, try them out and see what you like best, because they all do things a little bit differently, and it's really a matter of personal preference. So go ahead and try it there. I don't think they're a bad thing. I just don't want people using free ChatGPT to write progress notes. All right, so then David had asked, as long as it's a password encrypted, I think you were talking about maybe a laptop. So there's a difference between someone having to type in a password to access your computer and or device, and it being encrypted. I do not actually know beyond that what the difference is. That's why I recommend Person-Centered Tech. So they have some really good articles. They have free trainings. Again, they are a wealth of information. If you do join one of their, and this is not like an affiliate link I'm sharing. I just genuinely appreciate what they do, trust what they do, know them personally, and absolutely trust them. If you do have one of their paid memberships, then they have multiple Q&A sessions you can attend, or places where you can ask questions that are as specific as you want it to be. But they have a whole free training set that you can get CE credit for. And a lot of the things they offer CE credit for, you can also access for free. And then you just pay if you want the CE credit. So absolutely, I know that they have the answer to that question. I don't know it. I've heard it many times before and I can't remember. But I do know it's different than just having something be accessible or being password protected. It's not the same as being encrypted. So you do want to have both. And I think for Macs, it's pretty much a matter of it's probably already encrypted. So if you have that, you're good. All right, if we have no other questions, we will sign off. This has been a longer meeting. Thank you all for being here and managing the multiple links, because our other live had a whole mess happen. So thank you all for being here. Feel free to put your comments in your questions or comments in the comment section below if you're watching the recording, and I will try to get to those and answer them. And check out Person-Centered Tech, because they have amazing resources, and regardless of your position, you will benefit from just being on their email list. So even if you don't give them any money, be on their email list. I have multiple trainings available through them too. So we've collaborated, and you can always check those out as well. All right. Thanks everyone for being here. Hope you have a great afternoon. Bye.